Welcome to our video discussing cervical cancer, what you need to know. In this comprehensive presentation, we delve into the critical aspects of cervical cancer, from its causes and symptoms to early detection methods and preventive measures. Cervical cancer is a prevalent and serious disease affecting women worldwide. Understanding its nuances, including the role of HPV infection and the importance of regular screenings, is crucial for early intervention and successful treatment. Throughout this video, we will explore the causes behind cervical cancer, common misconceptions, and the symptoms individuals should be aware of. We'll also highlight the significance of early detection through screening techniques like the Pap test and ThinPrep, as well as the importance of HPV testing. Join us on this informative journey as we empower you with knowledge about cervical cancer, equipping you to take proactive steps towards prevention, early detection, and effective treatment. As usual, a like and subscription to your channel will help the channel grow. Don't hesitate to take a few seconds to support the creators of this video. We'll get to the main content now. Cervical cancer is a common malignant disease, one of the leading causes of death among cancers in women. Abnormal cell growth in the cervix initially infiltrates locally, then spreads to surrounding areas, and ultimately metastasizes to other parts of the body. Causes of cervical cancer. Human papillomavirus (HPV) is closely related to cervical cancer. Most infected individuals do not show symptoms, and the virus disappears after 1 to 2 years. However, in some cases, HPV persists, leading to the development of precancerous lesions and eventually cervical cancer. These precancerous lesions increase the risk of cervical, vaginal, penile, anal, and oropharyngeal cancers. While not everyone with HPV will develop cervical cancer, nearly all cervical cancer patients are found to have HPV. Types HPV 16, 18, 31, 33, 35, 45, 52, and 58 are identified as the primary causes of cervical cancer, with HPV 16 and 18 posing the highest risk. Other risk factors include smoking, both active and passive, early sexual activity, early childbirth, oral sex, poor hygiene conditions, contracting sexually transmitted infections. 2. Symptoms of cervical cancer. In the early stages, individuals often do not experience symptoms, and the disease is usually detected through screening, cervical endoscopy, or cervical vaginal cytology. However, invasive cervical cancer may present with symptoms such as pain during intercourse, abnormal vaginal bleeding after intercourse, between periods, in postmenopausal women, foul-smelling vaginal discharge mixed with blood, fatigue, weight loss, abdominal and pelvic pain in later stages. 3. How to detect cervical cancer early. Cervical screening through colposcopy for sexually active women can detect precancerous lesions in the early stages or invasive lesions such as ulcers, bleeding, and abnormal signs on cervical vaginal cytology slides. Cervical cytology tests are relatively simple, easy to perform, and highly effective in early detection of cervical cancer. Common methods include the Pap test and ThinPrep. The Pap test is a traditional method to detect abnormal cervical cells. A small brush is used to collect cells from the surface of the cervix, which are then spread on a glass slide and examined under a microscope. Abnormal results, such as atypical squamous cells of undetermined significance (ASCS), often indicate HPV infection and may require further HPV testing. ThinPrep, a newer method, offers several advantages over the traditional Pap test. Cervical cells are collected with a specialized instrument, then filtered to remove mucus, red blood cells, and white blood cells, creating a single cell layer on a glass slide. This makes it easier to detect abnormal cells under the microscope, providing more accurate results than the conventional method. HPV testing can be performed concurrently with the Pap test. Instead of detecting cellular changes, HPV testing searches for the presence of HPV virus. Positive HPV results may warrant further testing to determine if high-risk HPV types such as HPV-16 and HPV-18 are present. As we conclude our discussion on cervical cancer, what you need to know. It's evident that awareness and education are crucial in the fight against this disease. By understanding the causes, symptoms, and early detection methods, individuals can take proactive steps to protect their health and well-being. Cervical cancer may be a formidable opponent, but with knowledge comes empowerment. Through regular screenings, such as the Pap test and HPV testing, individuals can detect abnormalities early, greatly increasing the chances of successful treatment and survival. We urge everyone to prioritize their health by seeking regular checkups, practicing safe behaviors, and advocating for access to cervical cancer screening and prevention programs. Together, we can raise awareness, dispel myths, and ultimately, reduce the burden of cervical cancer on women worldwide. Remember, early detection of cervical cancer greatly improves the chances of successful treatment. Therefore, to prevent and treat the disease, it's essential to undergo regular screenings, seek medical attention, and receive a timely diagnosis when experiencing any unusual symptoms. Thank you for watching. Goodbye and see you in the next videos. Once again, thank you so much for watching this video, and I'll see you in the next one. Take care, and have a fantastic day.